This video focuses on assessments of the neurological system. Viewing this topic will enhance your ability to identify common and concerning problems related to the neurological system, employ appropriate interviewing and techniques of therapeutic communication as you gather subjective data, perform and assist in performing tests and examinations for different elements related to this system, understand normal findings as you assess, and document and communicate neurological findings clearly and accurately. The neurological or nervous system is complex. It is responsible for coordinating and regulating all body systems and functions. In simple terms, the nervous system consists of the central nervous system, comprising the brain and spinal cord, and the peripheral nervous system, responsible for carrying information to and from the central nervous system and consisting of cranial nerves, spinal nerves, and peripheral nerves. Peripheral nerves consist of two types of fibers, somatic and autonomic. Somatic fibers, nerve fibers that carry impulses from the central nervous system to muscles and skin, controlling conscious or voluntary activities. Autonomic fibers, nerve fibers that carry impulses from the central nervous system to the involuntary smooth muscles, organs such as the heart and kidneys, and glands, controlling unconscious or involuntary activities. Common and concerning problems of the neurological system include numbness, weakness, or paralysis of a single limb or one side of the body, generalized weakness, loss of motor control, dizziness or vertigo, tremors, seizures, or involuntary movements, difficulty swallowing, confusion or memory loss, decreased sensation or tingling, changes in ability to process language, loss of clarity in vision or hearing, changes in touch, taste, or smell, decrease in balance, coordination, or gait, and severe headache.
As a nurse, you may be tasked with assessing clients to identify actual or potential health problems resulting from neurological dysfunction. So it's important to ask about each of these common and concerning problems. Whenever the client indicates a positive response, use effective communication techniques to gather more detailed information.
For learning purposes, this video will demonstrate the collection of subjective data from a client undergoing an emergency assessment. Then, the video will demonstrate a selection of common tests as they might be performed on a healthy client during a detailed assessment of the neurological system. Some of those tests will also be conducted on the emergency client and will lead to abnormal findings.
Mrs. Eckert, 67 years old, has been admitted to the intensive care unit today because she has just experienced her third transient ischemic attack, or TIA, in 2 weeks. Mrs. Eckert is accompanied by her adult son, who will serve as a secondary source of subjective data. Although this situation is acute and emergent, the approaches to interviewing and subjective data collection demonstrated here are useful when gathering neurological data for all clients. The nurse will conduct an interview to determine Mrs. Eckert's current state of health.
Mrs. Eckert?
Yes.
Good afternoon. My name is Nam.
I'm Jerry Eckert. I brought my mom in today.
Hi, Mr. Eckert. Hi, Mrs. Eckert. My name is Nam, and I'm the nurse practitioner. I'll be conducting your examination. Mrs. Eckert, would you like your son to stay in the room with you while we talk?
Yes, please. I'd like him to stay.
Mrs. Eckert, can you tell me what brings you here today?
Well, I've been having the same feelings I had last time I came in, only worse.
I'm very sorry to hear that. Let's see. You were here just last week, and at that time you were diagnosed with a transient ischemic attack, what's called a mini stroke. And at that time, we started you on a blood thinner and a cholesterol medication. Now, Mrs. Eckert, I'm going to ask you a few questions to determine your current state of health, and then I'm going to carry out a series of simple tests to see how you're doing, okay?
Yes, okay.
By obtaining a history of present illness that explores the features or variables of the specific reason for seeking care, along with related symptoms, you will better understand the client's perspective and be able to provide a detailed record of her experience as care progresses.
Mrs. Eckert, can you tell me in your own words how you're feeling right now?
The side of my body has become very heavy, and my arm feels very weak.
Can you show me exactly which part of your body feels weak?
Here, my whole arm.
Is the weakness continuous or does it come and go?
It started about 3 hours ago, and it still feels pretty much the same.
Actually, Mom, it started about 5 hours ago. She first noticed it at the breakfast table when she was having difficulty with utensils.
That must have been very difficult and scary when that happened. Have you noticed any weakness in any other parts of your body?
No, just my left arm.
In an emergency, you will employ closed-ended questions more frequently than in non-emergency settings. By seeking specific facts or yes or no answers, you can save critical time and more quickly pinpoint the client's symptoms.
Do you feel any tremors or any shaking?
No.
Do you have any difficulty swallowing, tasting, or smelling?
No, those are no problem.
And since you first experienced your current problem, have you noticed any changes in your sight or in your hearing?
No.
What about your ability to speak or understand other people's speech?
That all seems fine, too, now anyway. But this morning, my family said I wasn't making any sense when I was talking.
Yeah, when Mom tried to explain it to us, she was hard to understand at first. Her speech was slurred and halting.
I see. And when did that stop?
Jerry?
It disappeared in about 2 hours, but the weakness was still there, so we decided to bring her in.
Do you have any dizziness, lack of coordination, trouble walking or keeping your balance?
No.
Have you had any difficulty with your memory today or your ability to concentrate?
No, I don't think so.
Actually, Mom, you have been a bit forgetful today.
Have you missed any doses of your blood thinner or cholesterol medication?
Oh, maybe the cholesterol medicine once or twice, but the blood thinner makes my stomach hurt. So I stopped taking it, I don't know, yesterday?
And have you taken any additional medication for this new problem?
Jerry?
We just thought it best to bring her straight in.
Document your subjective findings as soon as possible in the client's health record. Be sure to report both positive and negative findings clearly and accurately. Provide details about any positive findings to give as clear a picture as possible about the client's current health concerns. A comprehensive neurological assessment typically involves evaluation of 5 areas: mental status, cranial nerves, the motor and cerebellar systems, the sensory system, and reflexes. Keep in mind that in-depth neurological assessments usually are performed by advanced-level healthcare providers such as nurse practitioners and physicians. However, it's important that registered nurses know what techniques are involved so that they are better prepared to conduct and assist with specific tests when needed. The tests shown in this video are intended to acquaint viewers with the wide range of neurological assessment techniques that comprise a comprehensive neurological assessment. In actual practice, healthcare providers may perform only subsets of the tests depicted in this video, depending on the client's chief concern, the healthcare setting, or other parameters. The choice of neurological assessment elements depends on many variables. Always see to client privacy and comfort. And before you begin your assessment, perform hand hygiene. Make sure your hands are warm before touching the client. And whenever possible, arrange the sequence of assessment steps so as to minimize the number of times the client must mount and dismount the examination table.
Tools and supplies used during assessment of the neurological system include gloves, examination gown and drape, substances to smell such as lemon juice or vanilla, sterile cotton balls, an insufflator bulb, opaque card or eye occluder, handheld vision chart, Snellen chart, ophthalmoscope, pen light, pen or pencil, paper clips, broken cotton swabs or other pointed objects, a blunt instrument such as a retracted pen, tongue depressor, drinking cup, test tubes containing hot water and cold water or ice, a low-pitched tuning fork, objects to feel such as a large coin, paper clip or key, and a reflex or percussion hammer.
The components of the mental status assessment involve evaluations of level of consciousness or alertness and appropriateness of responses, along with assessments of movement, balance, coordination, sensation, and reflexes whenever opportunity presents itself. The mental status portion of the assessment does not need to be conducted separately. Instead, assess mental status throughout your interaction with the client.
Ms. Wallace, I'm going to say 3 words. I need you to repeat them back for me. Ready?
Ready.
Table, quarter, pony. Can you repeat them for me?
Table, quarter, pony.
Now I want you to remember these words because in a few minutes I'm going to ask you to repeat them back for me.
Okay.
Now, can you tell me what today's date is?
It's Monday, July 23rd, about 2:30 p.m.
And tell me where you're located.
I'm at the health clinic on Route 3.
Good. Now, can you tell me those words that I asked you to remember?
Table, quarter, pony, right?
Right. The client is alert and oriented to time, place, and person. Speech is clear and articulate.
Because Mrs. Eckert has experienced the TIA, her responses to an identical mental status assessment result in abnormal findings.
Now, Mrs. Eckert, I'm going to ask you to say 3 words. I need you to repeat them back to me. Ready?
Go ahead.
Table, quarter, pony. Okay, can you repeat them back to me?
I got quarter and pony. Was the first one table?
Yes, very good. Now, try to remember them because I'm going to ask you to repeat them again in a few minutes, okay? Now, can you tell me what today's date is?
Well, I know it's a summer because it's so hot out there. July, but I don't know the exact date.
It's okay. And can you tell me where you are?
Well, I'm in the hospital, right?
Yes, you are. Great. Okay, now can you tell me what the 3 words are that I asked you to remember?
Well, I know one was table, but wasn't the other one an animal?
That's okay. Client is oriented to location and season, but not date. Delayed recall noted with 1 out of 3.
Each of the 12 cranial nerves has specific functions. To test them, various techniques are used. A complete assessment of the functions of all 12 cranial nerves, however, is seldom called for unless a problem is suspected. Nerve 1, the olfactory nerve, controls sense of smell. For this assessment, 2 or 3 fragrant agents should be prepared. For example, vanilla extract and lemon juice.
Okay, now we're going to test your sense of smell. Before we begin, do you need to clear your nose?
No, I'm fine.
All right, let's start with you closing your eyes and taking 1 finger and closing off 1 nostril. Tell me what you smell.
It's lemon.
Right. Can you close the other nostril for me? Tell me what you smell.
That's vanilla.
Good.
Cranial nerve 2, the optic, controls visual acuity, visual fields, and the ocular fundi. Assessment of cranial nerve 2 consists of tests for near and distant visual acuity, and the visual fields, and inspection of the retina and optic disc. These tests are demonstrated fully in Volume 3 of this video series. Cranial nerves 3, the oculomotor, 4, the trochlear, and 6, the abducens, together control the extraocular movements of the eyes. Assessment for these nerves includes tests for pupillary response and accommodation. These tests are also demonstrated fully in Volume 3 of this video series. Cranial nerve 5, the trigeminal, controls the corneal reflexes, facial sensation, and jaw movements, as well as aspects of voice and speech.
I'm going to press on your face muscles now. Please look straight ahead. Clench your teeth for me. Now relax. Good. Now I'm going to touch your face with a swab stick. I'm going to need you to tell me if you feel sharp or dull, and where you feel it. Before we begin, this is sharp, and this is dull. Now close your eyes for me. Tell me what you feel.
Sharp on my forehead. Dull on my forehead. Sharp on my right cheek. Dull on my right cheek. Sharp on my chin. Dull on my cheek, left cheek. Dull on my left cheek. Sharp on my nose.
Very good. Next, I'm going to blow some air into your eyes. Look straight ahead and try to keep your eyes open for me. Good.
Cranial nerve 7 is the facial nerve that controls facial movements and some aspects of voice and speech. It is assessed by testing motor function.
Next, I'm going to ask you to look at me, smile. Now I want you to frown and wrinkle your forehead. Now grimace and show me your teeth. Okay. Now I'd like you to puff out your cheeks. Now can you purse your lips like you're going to whistle? Good. Now I want you to raise your eyebrows for me and close your eyes very tightly. Now keep me from opening them. Good.
Cranial nerve 8, the acoustic vestibulocochlear nerve, controls hearing. This nerve is assessed by conducting the Weber test and the Rene test. Both tests are demonstrated fully in Volume 3 of this video series. Cranial nerve 9 is the glossopharyngeal nerve. Cranial nerve 10 is the vagus nerve. These nerves control swallowing, the rise of the palate, and the gag reflex. Nerve 10 also controls aspects of voice and speech.
Open your mouth, stick out your tongue, say ah.
Ah.
Okay. Now I'm going to touch the back of your throat. You may feel some discomfort. Okay. You all right?
Yes.
Okay. Miss Wallace, can you take a sip of water for me?
Yes.
Good.
The spinal accessory nerve controls shoulder and neck movement.
Next, I'm going to push down. Try and shrug your shoulders for me. Good. Now I'd like you to take your cheek and push it into my hand. Now the other way. Good.
The 12th nerve, the hypoglossal, controls tongue symmetry and position, as well as aspects of voice and speech.
Now stick out your tongue for me and move it side to side. Okay. Now I want you to take your tongue and push it against your cheek into my hand. Good. Let's do the other side. Good job. Cranial nerves 1 through 12 are intact.
Many tests that are part of the neurological assessment are also conducted during the regional assessment of the musculoskeletal system. Demonstrations of tests involving the motor and sensory systems, including the condition and movement of muscles, gait, balance, and coordination, can be found in the musculoskeletal topic of this video series. During the assessment of motor and cerebellar systems, the examiner should record any unusual involuntary movements. Remember to grade muscle strength on a scale of 0 to 5+. To assess for balance, the client can perform demonstrations of walking while the examiner checks for symmetry, posture, rhythm, balance, and freedom of movement.
Okay, if you will for me, I would like you to walk towards the door. You can walk back. Great. Next, I'm going to ask you to walk heel to toe like this. Can you walk back for me on your toes? Now could you take a few steps for me on your heels? All right, come back. Good. What I would like you to do next is, if you would, take a deep knee bend on one foot. I've got you if you feel like you're gonna lose your balance. Let's do the other leg. You all right?
Yes.
Good. All right. Now, can you hop in place on one foot for me? Okay. Now the other leg. Great. Now stand nice and tall for me, feet together. And I'd like you to close your eyes. I'll be here if you feel dizzy.
The Romberg test assesses equilibrium. It is also used in the assessment of the ears. The examiner checks for any swing.
Okay, very good. Now in the same position with your feet together and standing nice and tall, I would like you to bring your arms up in front of you, palms up, and close your eyes. Now keep me from pushing your arms down. Good job. Let's get you back up on the table. The client walks smoothly without swaying. Balance is intact. Romberg and pronator drift are within normal limits.
Various tests of coordination help to identify cerebellar functioning.
Now I'm going to perform some tests to assess your coordination. The
Okay.
first test we're going to do is take your index finger and touch my finger, then your nose, back and forth. Good. Now do it with your eyes closed. Very good. Let's do the other finger.
Another test of coordination is the assessment of rapid alternating movements.
Now, take your thumb and touch each finger as quickly as you can. Can you increase your speed as you go? All right, let's do the other hand. Now take your hands, put them palm down on your lap.
Okay.
Now turn them over and back. Let's see how fast you can do that. All right, nice job.
A final test of cerebellar function is called the heel to shin test.
Now I would like you to take your heel and run it down the opposite shin. All right, can you look away or close your eyes and do that for me? All right, let's do your other leg. Coordination of movements is appropriate and within normal limits.
Due to her neurological problems, Mrs. Eckhart performs the rapid alternating movements very slowly.
Okay, you can stop now. Client's cerebellar function is impaired. Rapid alternating movements are decreased, with slower movements noted on the left.
To assess the sensory system, test light touch and pain. If abnormalities are found there, then also test temperature sensation. In each instance, the client should close her eyes. Light touch is tested using a cotton wisp or an insufflator bulb.
Could you close your eyes for me? I would like to assess your sense of light touch. Let me know when you feel the cotton ball and where you feel it.
Forehead. Right cheek. Left cheek. Chin. Neck. Right arm. Left hand. Right knee. left shin, right foot, left foot.
Okay.
To test pain sensation, use the point of a broken swab.
I'm going to ask you to tell me if you feel sharp or dull again. This is sharp, and this is dull. Now close your eyes and let me know where exactly I am touching you.
Sharp, forehead. Dull, right cheek. Sharp, left cheek. Sharp, chin. Dull, neck. Sharp, right arm. Dull, left hand. Sharp, right hand. Sharp, right knee. Dull, left shin. Sharp, right foot. Dull, left toe.
When testing temperature sensation, use test tubes, one filled with hot water.
Close your eyes for me so we can assess your sense of temperature. Tell me which one is hot and which one is cold.
Hot.
Okay.
The other filled with cold water or ice.
Cold.
Next, test vibratory sensation and position sensitivity. If vibratory and position sensation are felt at the most distal point, the area or extremity need not be tested further. Test vibratory sensation.
Okay, close your eyes for me and tell me what you feel.
Vibration on my right index finger.
Okay.
Typically tested are the finger joints, wrists, elbows, shoulders, toes, ankles, shins, and the sternum. Next, test position sensitivity, beginning distally.
Now I'm going to ask you to tell me which direction I'm moving your finger. This is up, and this is down.
Okay.
Okay, can you close your eyes for me? Let's begin.
Up. Down. 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 Down.
The test of stereognosis helps to determine if the client can identify objects correctly by touch.
Okay, I'm going to put some objects in your hands. I want you to close your eyes and tell me what you feel.
A key.
Okay.
A paperclip.
Okay.
It's a coin. A quarter.
Okay. The client's sensory system is intact using touch, point localization, vibration, pain, and temperature. Position sense is intact. The client is able to correctly identify objects placed in her hand.
When Mrs. Eckhart is assessed, her TIA prevents her from correctly identifying the items placed in her hand.
Next, Mrs. Eckert, I'm going to ask you to identify some objects that I placed in your hands. So close your eyes. Okay. This is the first item. What is this?
I can't really tell.
That's okay. The client is unable to identify objects placed in hand.
To assess two-point discrimination, the examiner uses a flexible two-pronged instrument, such as one bent paperclip, pressing both points against the client's forearm, dorsal hands, fingertips, back, and thighs.
Now I would like you to tell me if you feel one or two touches to your finger. Let me demonstrate. This is 2, and this is 1. Okay?
Okay.
Do you feel the difference?
Yes.
Okay.
At each area,
One.
the examiner simultaneously presses the 2 points against the client's
One.
skin several times. Begin with a gap of about 1 to 2 millimeters, then
One.
widen the gap each time until the client can distinguish between both points.
2.
Assessment of graphesthesia involves the use of a blunt instrument such as a retracted pen to write a figure on the palm of the client's hand.
With your eyes closed, I'm going to trace a number in the palm of your hand. Let me know what it is.
3.
Very good. 2-point discrimination is intact. The client correctly identifies the number traced on her palm.
The final component of the neurological assessment involves testing of reflexes. A client's reflexes are graded on a scale as follows. 1+, meaning the reflex is present but decreased. 2+, which is normal. Or 3+, meaning the reflex is increased or brisk. Here the examiner tests the deep tendon reflexes.
Just relax.
The biceps,
Next.
the brachioradialis, the triceps, the patellar, the Achilles, and the plantar. The nurse also assesses the superficial abdominal reflex.
The deep and superficial reflexes, all 2+ bilaterally.
When subjective and objective data collection is complete, the nurse documents both positive and negative findings, using the correct phrasing of the documentation of normal findings as demonstrated during the assessment. Today's findings will assist these clients' care providers in their efforts to optimize Mrs. Eckert's and Ms. Wallace's existing functions while initiating any critical steps for needed interventions. At the end of Mrs. Eckert's evaluation in the intensive care unit, while awaiting the arrival of the attending physician, the nurse practitioner reassures the family while explaining what they should expect regarding the hospital course and the risk of the TIA progressing to a stroke. The nurse practitioner also begins to prepare the family for changes needed at discharge, raising the issues of smoking cessation, dietary changes, and the need for regular aerobic exercise as her age, state of health, and primary care provider permit.